Good afternoon, guys. This is Miss Rhea, and today is another bunch of information that I will be sharing to you guys. We had a short discussion last week wherein we had tackled so much information, and for those students who were late enrollees, so I want you guys to listen carefully because we will be recalling some of the most important topics that we had discussed last week. Okay, so first, the highlight of our previous discussion primarily talked about the meta paradigm in nursing. Okay, so the meta paradigm in nursing definitely comes from the Greek word meaning meta paradigm, with, and paradigm means pattern. So this is a pattern or models used to show our relationship among four concepts. So when you are being asked what are the four meta paradigm in nursing, of course this would be your answer: person, environment, health, and nursing. So these are the four meta paradigm in nursing, and I want you guys to memorize those four meta paradigm in nursing. Okay, let's discuss one by one briefly the four meta paradigms. The first one would be person. From the word person, okay, this is the recipient of nursing care. If you are working in a hospital, the person itself is your patient, the individual. Okay, when you're working in a community settings, that your client would be the families or the communities itself. It's like that. So it depends upon where are you located or where are you working on at that moment. And then a person is considered as the passive recipient of care. So when we see passive, it means they are just waiting for your intervention. So they are just receiving. Okay, and of course, the next would be environment. Environment is self-explanatory already. It talks about the external and internal aspect that influence the person. It talks about the ventilation, the warmth, the noise, the light. Okay? Mao na makaapekto sa health sa patient. Kasi di ba, I actually highlighted last week that if you are going to conduct an experiment, for example, and you place a patient in a crowded area, okay, in a they have poor ventilation like that, hindi maganda yung environment itself. And then the other one naman is you going to place the patient in a suitable environment. So kung i-compare na nimo daw sila, the more or mas dali maka-recover ang those patient na naa sa maayong environment. When you're going to contrast it to those patient, nagibutang nimo sa non-suitable environment. So that's how environment could affect the health of the person, generally speaking. Okay? So the third would be health. Okay, when we say health, it's a holistic level of wellness. So I also mentioned last week that when we see holistic, it's just not talking about the physical aspect. Okay, you really have to dig deeper. Like we are talking about the emotional aspect, psychological aspect of the person, the spiritual aspect. So that's what makes a person healthy holistically. Okay, the fourth one would be nursing. Okay, nursing is the interventions of the nurse or the rendering care in support of the patient. We say rendering care, it's how compassionate you are, it's how altruistic you are. Altruism is a an attitude of the nurse who is actually helping other people without expecting any return. It also involves sympathy, of course. So this is a matter how you intervene, how you care your patient, how you establish rapport to your patient, how you establish an open communication to them. So this is part of the part of the meta paradigm in nursing, which primarily we are talking about nursing itself. Okay, yun lang naman yung highlight natin last week. So as a sort of recall, we have four meta paradigm in nursing, namely person, health, environment, and nursing. So we have four, and you really have to memorize those four meta paradigm phases so that it would be easier for us to understand our subsequent topics. Okay, so before proceeding to our next topic, I want you guys to remember that you will gonna screenshot your first activity that we had last week. So make sure you have screenshot the result, and you will going to keep it for your personal reference, because at the end of the month you will be computing your own grades, so that would actually create a transparent transparent recording or keeping the track between the teacher and the student. So it would be easier for you guys to track your progress. Okay, so our topic for today is we'll be talking about nursing theorist of historical significance. When we say theorist, it is also the name, okay, the name of the theorist, okay, the one who established a particular philosophy or particular idea. So theorist tawag sa ila tao, okay. Okay, we'll be talking Hildegard Peplau, Virginia Henderson, Faye Glenn Abdullah, Ernestine Wedenbach, and Lydia Hall. Okay, and another batch. Okay, as a sort of like heads up to you guys, we will just talking the brief information about them. Okay, the major achievement, the name of the theory, ganun lang yung i-discuss natin this afternoon. Because as we go along with our lecture, we will be discussing all of them, and we will going to dig deeper with regards to their minor achievement, where did they finish their courses, or ano ba yung mga na-contribute nila to the nursing professions. But as of the moment, we will just discussing briefly, okay? We will be discussing Joyce Travelby, Catherine E. Barnard, Evelyn Adam, Nancy Rupert, Logan and Allison Tierney, and Ida Jean Orlando. Okay, hindi ito lahat, guys, okay? There are more name of the theorists that we will be discussing in the future. Ko, hindi lang ito yung mga theory na i-discuss natin, okay? We will be discussing more in the next discussion. Okay, the first thing that we'll be discussing this afternoon, we'll be talking about Hildegard E. Peplau. Pag narinig nyo si Peplau, you will gonna remember that Peplau talks about theory of interpersonal relations. Okay? Pag narinig nyo si Peplau, yun yung dapat isipin nyo. It's Peplau formulate a theory named Theory of Interpersonal Relations. So from the word interpersonal, it's just like a communication between a two-person, or a communication between a receiver and, of course, the one who gave information, or the one who instruct something important like that. So Hildegard Peplau, she's considered as a mother of psychiatric nursing. So psychiatric nursing, guys, is also part of the curriculum of nursing. Usually, matake ninyo na siya when you reach third year. Kung mag third year mo, I think you will going to undergo a lot of lecturing process, wherein the instructor will going to tell you more about mental alteration. Kaya mga buang in our Bisaya quote, okay? Mga buang sa mga sa mga psychiatric facility, and afterwards during your summer after third year, yeah, am I right? Yes, you will be exposed. I hope the pandemic will actually subside, but I doubt. You will be exposed to a psychiatric facility wherein you will be dealing those persons who are actually dealing some mental alteration. Okay, so Peplau served as an executive director and a president of ANA. When we say ANA, you have to remember that it is American Nurses Association. Okay, American Nurses Association. She first taught the first classes of the graduate psychiatric nursing students at Teachers College, Columbian University. Okay, she also stressed the importance of nurses' ability to understand their own behavior. So, as far as I remember, prior deploying you guys to a psychiatric facility, you will be having somehow a self-introspection time. So, you will gonna assess yourself first. Kasi possible, mabuang po ka dito. Diba? Pag abot mo sa psychiatric facility, if you will gonna know yourself better, if you will not assess your behavior, your own behavior first prior deploying yourself to a psychiatric facility, there is really a high chances of yours to be, to have some mental alteration. Kasi pagdating mo dun sa psychiatric facility, you will gonna be shocked, like, buang ba ni sila? Or, ingana. But of course, guys, bawal mo yung buang during deployment. Kasi bawal. It's a big no mo yung buang. Ganyan. So, you have to do some sort of self-assessment. Baka di mo makayanan pagdating mo doon, you're going to suffer more. Like, syempre, maapektuhan ka, or somehow ma-influensyahan ka. somehow like that. But it's a rare scenario naman kasi that's why you really have to assess yourself first prior deployment or prior going to a psychiatric facility. Kasi the last time na remember ko, year 2014, when we had our psychiatric exposure, grabe, pagsulod gud nimo sa sa facility, dili ka makaingon na ano sila, na something. Like they are behaving like a normal person. They will going to communicate with you like a normal person. Makaingon ka ngano na admit man ni sila diri. But of course, wala lang ta kabalo deep inside, they're also suffering from some mental problems. Okay? She also produced or somehow published a particular book, Interpersonal Relations in Nursing, 1952, which also described the importance of nurse-patient relationship as a significant therapeutic interpersonal process. So, prior deployment as well, and even hindi lang tayo nagtutok dito na psychiatric facility, of course. Nagatok po ta dire kanang mga client nga nasa hospital. So it's very essential that you establish a good interpersonal relationship with your patient and also to their significant others. Okay, now, we will be discussing the four phases of nurse-patient relationship briefly, okay? We will be talking orientation, identification, exploitation, and the resolution phase. Usually, ito talaga yung four phases. And even when you are deploying a community setup, ito yung four phases na gina-follow natin kay PEPLAW. So, when you say four phases of nurse-patient relationship, you're going to, naunaan good ninyo always na that's the theory of Hildegard Peplau. Okay? In orientation phase, guys, this is the phase, sulat ninyo ha, this is the phase wherein you will going to get to know the patient, okay? You will going to establish rapport. You have to establish an open communication with them. In orientation phase as well, dira nimo i-open. Okay, open mo na, sir, ma'am, I am your nurse for today and I will be with you for like 2 weeks. So, in orientation phase pa lang, mag-establish na gid ka og boundary. Like, mag-establish ka kung when mo taman. Kasi they will going to expect more from you, like that. So, you have to establish na, ma'am, I am your nurse for today and I will be with you for 2 weeks. From 8 a.m. to 4 p.m. or from 7 a.m. to 3 p.m. I'll be with you. Okay? And we will be ending our exposure here after 2 weeks. So you will going to set a specific boundary for that. And then the next one would be, don't worry guys, because we will be tackling this deeper as we go along with our lecture kasi isa-isahon man nato ang different theory. Okay? The second step or the second would be identification phase. So in identification phase, from the word identification, when we say identification, we have to identify the problems, okay? I-assess na to atong patient, identify their problem, at the same time, we have to prioritize. So in our profession as a nurse, we really need to prioritize. I-prioritize nato katong mga less important, unsa po tong important or significant para handay atong trabaho. The third one would be exploitation phase. So in exploitation phase, diri na nahitabo tong mga intervention, treatment, how we will intervene or how we help the patient to recover, no? How we help the patient to develop their self-esteem, if problema nila is self-esteem, ganyan. So this is the treatment, or shall I say the important phase as well, kasi dira na nahitabo tong mga intervening variables, like you're taking good of your patient, you make sure that everything are settled, like for example na inom ni ang tambal, na-create kag mga therapy. So all the interventions are actually here in exploitation phase. And the fourth one, I'm sorry, it's supposedly 4, okay? The fourth one would be a resolution phase. When I say resolution, it's also a termination phase. Okay? When we say termination phase, of course, this is the end of the relationship. And somehow, di gyud na malikayan na mag-create magdepend sila sa atuwa. This is the hardest part sa ani nga phase, kasi the tendency is they will going to be super attached to you guys, and then ikaw pod ma-attach ka sa ila. That's why in the first phase pa lang mag-establish gyud tag boundary para dili sila mag-expect of more from us. Okay, hugot naman to, pero di gito siya hugot, guys. Okay, that's really the that's the truth. Okay, the second discussion, or the second theory that we'll be discussing this afternoon, we're going to talk about Virginia Henderson. Okay, Virginia Henderson talks about the 14 components of basic nursing care. So, of course, she viewed the patient as an individual who requires help. Who requires help towards achieving the independence. So, see, independence, like you are allowing the patient to do some activities of daily living. Like you allow the patient to do her own activity like ambulation. But of course, if the patient needs our help, we're gonna help. But of course, we have to initiate and we have to encourage them to be independent. And of course, completeness or wholeness of mind and body. Okay, she wrote 3 books, namely Textbook of the Principles and Practice of Nursing Care, which was published year 1955, Basic Principles of Nursing Care, published 1960, and of course, The Nature of Nursing, published in year 1966. So according to the definition of Henderson, the unique function of the nurse is to assist the individual, okay, sick or well, okay? Yun yung, ni Henderson yun yung, sick or well. Kasi usually, pag nasa mindset natin, all of the patients who are actually in hospital are actually sick, right? But of course, wider or broad ang scope ni Henderson. We say broad, they're not just talking to the sick individual coming from the hospital. Kanang po din siya sa sa community setting where we as a nurse, we will conduct wellness program, di ba, right? And so as a nurse, we have to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery. That he would perform unaided if he had the necessary strength, will or knowledge. So that's why we encourage the patient to be independent, okay? Help gain independence as rapidly as possible. Of course, here are the 14 basic needs. 14 basic needs according to Virginia Henderson. You're gonna read it, guys. It's in your book. That's why you really have to procure your own book for you to be updated with our discussion every now and then. So the 14 basic needs according to Virginia Henderson are the following: breathe normally, eat and drink adequately, eliminate body waste, move and maintain desirable postures, sleep and rest, select suitable clothes, and so on. So you're gonna read those, guys. Okay, those are the 14 basic needs according to Virginia Henderson. Okay, the 3 level of nurse-patient relationship in which nurses act as a substitute for the patient, helper to the patient, and partner with the patient. Nurses must work in interdependent. Kasi iba din kasi yung independent. Kaya when you say independence, you are allowing your patient to do the own, or you do the procedure, or you do some of the activities of daily living like ambulation, combing their hair, bathing. Kasi 'di ba, some of our patients are actually they need to be assisted, or they need assistance from the healthcare professionals. When we say interdependence, we are not talking the wider dimension like nurses, patient, doctors, rad tech, laboratory technicians. So interdependence meaning iba-ibang modalities or iba-ibang practice. We're not just talking nurses alone, patient alone, but of course wider dimension. Okay, we have done discussing Hildegard-Peplau, which talks about the can you recall the Peplau theory? And we also have Virginia Henderson. So you're gonna memorize the theory of those 2 theorists. Okay, the third one would be Faye Glenn Abdillah. Okay, Faye Glenn Abdullah talks about 21 nursing problems. So, kung si Virginia Henderson na siya 14 basic needs, si ano naman, Faye Glenn Abdullah, mayroon siyang 21 nursing problem, di ba? So, Faye Glenn Abdullah, recognized as a leader in the development of nursing research. It's di ba? Typo error. She is also considered as an international expert on health problems. She was inducted into the National Women's Hall of Fame in year 2000 and the first woman and the nurse deputy surgeon general. According to Faye Glenn Abdullah, nursing is an art and a science. Okay? Diba? Common na siya. What is nursing? Of course, nursing is an art. Nursing is a science. Why? When we say art, every nurses have different way of intervening to their patients. So, iba-ibang nurses, iba-ibang ways of iba-iba tayo ng pamamaraan. Of course, in accordance to the basic thing. Kailangan tama din yung ginagawa natin. Although iba-iba tayo ng ways of intervening, dapat in accordance pa rin kung ano yung tama. As a science, of course, kasi nag-undergone siya in a sort of scrutinization. Nag-undergone niya ng all of the procedures that we have we are been doing in the hospitals. Of course, undergone some scrutinization, undergone some experimental procedure, and also there are so many researchers outside, diba? So that's because of science that mold the attitude, the intellectual competencies, and technical skills of individual nurse, their ability and desire to help individual cope with their health needs. Okay, so here in your book, you can actually read the 21 typology of according to Faye Glenn Abdullah. You can actually read that whole one. To maintain a good hygiene and physical comfort, to promote optimal activity like exercise, rest and sleep, to promote safety through prevention of accident and injury. So you can actually read those one, guys. Okay, but if you need the actual typology of 21 typology of nursing problems, you can actually either you can procure your own book and read it by you, or you can actually message me if you don't have your book with you now. Okay. But of course, you can screenshot this one. I will be posting it in YouTube for you to recall the topics every now and then. But of course, you have to tell me, guys, if super pas-pas yung pacing, because I can adjust for you. Ito, 21. Okay, now let's discuss the fourth one. Okay, Wedenbach, Ernestine, Wedenbach, 4 elements of clinical nursing. We will be talking philosophy, the purpose, the practice, and the art. Okay, the theory of Ernestine Wedenbach is what we call the helping art of clinical nursing. Known for her work in theory development and maternal infant nursing. Maternal is also part of the nursing curriculum nga ano siya sa maternal second year. Okay, second year you will going to start discussing maternal child health nursing. Okay, while teaching nursing at the School of Nursing, Yale University. Define nursing as view nursing as a nurturing or a caring someone in a motherly fashion. Okay, so syempre ang iyang focus is more on maternity. Ano ni Ernestine Wedenbach, iyahang gi-relate na ang nursing daw is like your mother, how your mother took good care of you, or how your mother take good care of you, how your mother offer care and support. So that's what nursing according to Wedenbach or Ernestine Wedenbach. Next would be Lydia Hall, the core care cure model. Okay, pang-ilan na ba ito? I think it's the fifth one, okay? We have Peplau, we have Henderson, we have Abdullah, we have Ernestine Wedenbach, and we have Lydia Hall. The fifth one would be Lydia Hall, the core care cure model. Lydia Hall was a rehabilitation nurse, okay? She established the Loeb Center for Nursing and Rehabilitation at Montefiore Hospital in New York. The later plan has been considered as the primary nursing. Okay, here in the diagram, you can see, guys, here in the diagram, you can see excuse me for a while, okay? We're going to fix my tripod first so that it would be, wait. Okay, So here you can see that the three circles are interlapping. So interlap, it means that they are connected with each other. So here we have the person, with meaning the therapeutic use for self, or the aspect of nursing, the core. When we say person, the recipient of care, we as the patient itself. Okay. Next would be the body. The body means that the natural and biological sciences that talks about intimate bodily care, or the care, how you give, how you offer care, how you offer intervention towards your patient. The third one would be disease, or the cure, seeing the patient and the family through the medical care. Like, it involves the interdependent or the collaborative aspect of nursing care. When we say collaborative, we are talking about the help of the doctor, help of the physical therapies, the help of the rad tech, and so many part of medical team. But of course, you don't need to worry, because we will be discussing it further as we go along with our lecture. We'll be discussing this theory one by one. This is just the brief discussion for you to have, general information with regards to our subsequence, or with regards to our future topics. Okay, the core, guys, it talks about the emotional and social needs of our patient. The emotional and social needs of the patient. It's the core, okay? It's care, it talks about hands-on bodily care to patients, such as the activities of daily living, how you help, how you assist your patient during ambulation, during first ambulation, of course, post-surgical procedure, how you help your patient, um, what are the activities of daily living? You help your patient to do some sort of one dressing. Of course, you do the dressing initially, but you have to give the patient a chance to learn from what you are doing. The next would be cure, meaning the nurses apply medical knowledge for the treatment of patient. Like, for example, your patient is febrile, okay? As a nurse, as an eligible nurse, you apply the tepid sponge bath, or TSB, could alleviate the patient problem, or it could primarily lower down the temperature of the patient. So that's how you apply medical knowledge for the treatment of the patient. Oh my gosh, wait guys. Wait.